first line, whatever you were doing in the ER or whatever. You were working in an hospital before or not? Or?
I was working in a lot of things.
I like people. I like to know people.
The first thing I did out of school, I did urgent care, but it was combined with internal medicine practice.
Yeah.
And so I learned a lot there. A very old school doctor I worked for.
Yeah.
We did everything in-house. We never referred anything out. But it was still conventional medicine, very by the book.
But you learned a lot.
I learned a lot. It was very good. And then after that, it was the pandemic happened, and then it was difficult because I called the CDC. I said, CDC, what do we do? They said, oh, Tylenol and send them home. And I said, this is not good enough. So what I did is I researched myself.
Yeah.
I looked at what Italy was doing, what the Russians were doing.
Yeah.
Russians were doing IV glutathione.
Yeah.
I was looking in France, they were doing melatonin, 50 milligrams, 100 milligrams in the ICU. I was researching mechanism of action of vitamin C, of zinc, of N-acetylcysteine, and ivermectin and hydroxychloroquine.
Yeah.
My boss says it's too political to prescribe this, so we cannot prescribe this. But still, I did everything else. I had this sheet, and I told the patients I had this sheet, like, you're gonna do this. Vitamin C, melatonin, glutathione, zinc, all these things. And I would prescribe dexamethasone or prednisone, the nebulizers, budesonide. They didn't complain if I prescribed azithromycin, so I prescribed
No, I
azithromycin.
was prescribing azithromycin.
They didn't think
and
twice.
hydroxychloroquine.
It was not political. Hydroxychloroquine, if I wrote the prescription like it was for arthritis, it wouldn't be a problem. But if the pharmacist saw that it was like a 10-day course, I would
You know what?
get the call.
I'm prescribing these medication for Lyme disease. So it's the same.
Yes.
How do you say it in English? Glutathione.
Glutathione.
Ouais, c'est ça. Parce que le H.
Yeah.
We prescribe that, and ivermectin, and azithromycin, hydroxychloroquine.
Yeah.
And it's on the line. We were fighting with the pharmacist.
You were fighting with the pharmacist
Yeah,
as well.
yeah. But I told them, oh, it's for Lyme, or it was
Yeah.
tricky, but it was like
It
that.
worked. I don't know why the pharmacist thought they were some savior.
But they were blocking. We couldn't prescribe ivermectin
Yeah.
because we didn't have some. And in the pandemic, for a short period or 6-month period, we couldn't prescribe Methylene Blue. They didn't have it. And they were scared, like Cortef. Now they're scared to serve Cortef when we prescribe.
Really? They don't want you to prescribe hydrocortisone?
No.
Why not?
Because they don't know that
They don't
you have
know
to prescribe
that,
DHEA with it
yeah,
long term.
adrenal
And
fatigue,
they
they
think
don't
like
believe in that.
they think like it will be a overload of cortisone.
But I do.
But it's like
DHEA,
it's still
I do.
They don't know the physiologic replacement dose.
No.
Hey, look, the guidelines are made by the groups of endocrinology, cardiology,
Yeah.
pediatrics, and
It's-
those are all controlled by the pharmaceutical industry.
not only
So
that.
they control the practice of medicine through the College of Doctors. And the
And
College of Doctors, they think that those organisms are right. And they, it's like,
And also when you're doing functional medicine principle of treatment, it's very scary for the specialist because you're treating the cause and you're getting back health. So sometimes it could be because we're treating in medicine, we're treating the consequences, symptoma, illness, we're doing diagnosis, but we don't question the cause of it.
Yeah.
And when we work on the cause, you bring back health.
Yes.
And that's very, very scary for conventional or traditional medicine
Yeah.
and pharmaceutical.
Yeah. They don't want.
You're doing the same thing as you're doing you keep your patient or your clients
We keep them
healthy.
well. Yeah. I just saw a guy today, did a follow-up. He said since he's seen me, he has not been sick. But since a child, he's always been sick. Always, like every couple
Yeah.
months. Pneumonia. But since I gave him vitamin D, B complex,
Yeah.
and acetylcysteine, he says he's no longer sick. Because his vitamin D is now 100 and he doesn't get sick anymore.
Yeah.
yeah, yeah.
And you can practice like that, but you must be
That we just get
Prudent. How do you say prudent?
Prudent?
Yeah.
Yeah, I don't think I'm prudent or anything. I just treat the patient. I just do what's right for them. And
I'm in the middle, you know. I'm trying to just educate also and give the choice
of course,
to the client. Yeah.
I do offer that as well. I say, because for example, recently I had a girl here. She had costochondritis. She couldn't breathe because the ribs hurt so much. And I say, well, you have this disease. In conventional medicine, you give prednisone, you can do ibuprofen, you can, wait 6 weeks, it'll go away. Or you can come here and do a cold plunge. And we can see what happens. We have no scientific data that says cold plunge can treat costochondritis. She chose the prednisone or the dexamethasone. And it helped, but it gave her psychosis. And she, it wore off, and she said, what can I do? I don't want to have psychosis, but I want this pain to be gone because I cannot breathe. Like, try the cold plunge. She did the cold plunge, and for 36 hours she had relief, and the relief was immediate. 1 minute after the cold plunge, she had relief immediately, and she had no real side effects other than being cold. It lasted 36 hours. She came again because the pain came back. She did it again and again. 36 hours relief. We did this 3 times, and by then she had resolved the costochondritis.
Do you use topical cream, analgesia?
Sure, yes.
Topical cream because we're doing compounding.
Yes.
Analgesia cream.
I don't do them that much because I have other alternatives
Yeah.
for pain management.
Yeah.
We have so many
I'm
other
doing
things.
a lot of pain management.
Everybody has pain.
Yeah.
Yeah. But the cold plunge we found is very effective for managing the chronic pain.
I know. Oh, I said, oh my God.
Other things for chronic pain, we like low dose naltrexone.
I love low-dose naltrexone.
It's fantastic.
See, it's the thing that's very, very easy to take.
Yeah.
It's not dangerous, no side effect.
No.
J'en prescris plein.
No side effects. I've never noticed side effects.
Yeah.
And then there's the peptides that are fantastic as well.
I don't know that much, but I would like to know more about
The
that.
Wolverine protocol, BPC 157 and thymosin beta 4. I've used this on a lot of patients, and I use it on myself. It's great for pain.
We could exchange by email. I
Yeah.
will give you my mes coordonnées. I will give you the way of reaching. We could collaborate.
Yeah, that'd be fun.
It would be great.
I mean, the peptide
I
is
could
so
interview
good for
you
pain.
distance too.
Yeah, of course.
Quebec in English, it's okay too.
Your patients understand English?
Yeah, but I have a lot of English people, English speaking people.
Let's see what else works for pain very well. Anabolics, of course, testosterone, DHEA.
Yeah.
When you give these back, it makes the tendons and the ligaments stronger, and they don't have pain when they work out. For example, my mom, she's 60 something. She never wanted to go to the gym because when she did the pull down, she said it hurts too much. Like, Mom, what do you mean it hurts too much? It hurts in my muscles. Well, I'm like, Mom, that's a good thing. But she's like, it hurts for like 7 days. I can't recover. That's not normal. Then I gave her DHEA, testosterone, and she recovers in a day. And now she goes every day to the gym, and it doesn't hurt for 7 days.
Yeah.
So now she has that repair factor again. So she has that anabolic activity. So her ligaments are stronger, her tendons are stronger, her bones are going to get stronger, and her muscle can grow.
How old is she?
I think she's 60 now.
Like me. I'm 60. Just turned 60.
That's great. Other things that are great for pain, obviously estrogen and
Yeah.
progesterone, highly anti-inflammatory, very good for the joints as well.
I love
Estrogen.
progesterone. Pregnenolone.
Pregnenolone too.
Yeah.
It's also great for sleep. I'm now doing the sleep compound. It's progesterone, pregnenolone, and DHEA. I put it in a capsule to take it at night.
Okay.
The progesterone and pregnenolone help most for sleep. But
And we could exchange. Oh my God.
oh
Blessed to be here.
yeah, Pierre.
Yeah,
Like
blessed.
you
Non, je te texte,
you start to work here tomorrow.
You
I'm
were
excited to talk to you, and you're generous. Me too. I'm observing my patient and documenting because the data is important. It's how do you say, a living lab.
Yes.
We are in a living lab, and in science too.
It is.
Because we're doing things, we are observing, monitoring, so it's very safe, and people are getting better.
Yes.
So we must work that way and put that with the science or base evidence, and together it's stronger.
Yeah, the one thing that I have to explain to patients who have gone to the conventional model.
Yeah.
In conventional model, one drug treats one condition because you have the diagnostic criteria,
Yeah.
you have the pharmaceutical
Yeah.
indication, you get insurance approval, and then you prescribe the drug.
Yeah.
But then here we have multimodality approach. Okay,
Yeah,
we're going to do the
it's like
nutrients,
that.
we're going to do the hormones, we're going to do the peptides, we're going to do the exercise, the cold plunge, the sauna. And these people get better. And so it's difficult to make a study out of this because you have all these variables, and the patients tell me, well, I don't know which one helped me, but I feel fantastic. I'm like, does it matter?
You're better.
You're better.
Yeah.
It's like-
You're like a small wellness center here. You're using a lot of
Modalities.
Yeah,
Yeah.
complementary
Complementary.
and personalized because people are not reacting to everything the same way.
Correct.
We have our epigenetic and genetic, but genomic and also a lot of variant, as you say.
The other thing that is sometimes very difficult for people who've been in the conventional model to understand is that the diagnosis to me is important, but not super important because
No, neither me.
I don't know how it is in Canada, but the reason people want diagnosis here is to get insurance approval for a drug.
Mhm.
So for me, it doesn't matter so much. I don't need
Right.
that.
We focus
like
we focus on the diagnosis, but not on the patient.
Yeah.
The diagnosis doesn't talk of the cause.
Correct.
Like,
Like
the
I
patient is
said
having an
before.
inflammatory condition. Is it the FLT? Is it the lupus? Is it rheumatoid arthritis? We don't care. It's the same cause.
It's the same cause.
Treat the cause and then we'll all go away.
Inflammation.
But if you have a diagnosis, one is a blocker of TNA alpha, the other one is so they have different
They
treatment, different
express the
things.
symptom.
Because they made a study that says,
Yeah.
you should treat that condition, but you should treat the whole patient.
Yes. So I don't really need to do the ANA, the biopsy, the set rate. If they have the inflammation, we're gonna fix the inflammation. They're gonna get better.
And one thing I've discovered,
We call it lifestyle medicine.
Lifestyle medicine.
when
Yeah,
I
it's like
started
that.
to give testosterone to patients, they were coming because they were lack of testosterone, tired, low muscle. Okay, then I would give them testosterone, and they say, "Oh, it's funny. Since I take testosterone, I have no more headache." But they never came for the headache because I was a hormone doctor, I was not a neurologist.
Ah.
But the testosterone,
Oh,
they
I
have
see,
more
we see,
headaches.
they get
So
better.
like you say, you treat the whole person with everything, and all the disease will stop.
Yeah. Who knew
Even the one that
testosterone
didn't
could fix
know.
a headache, but for this person, it fixed the headache.
Yeah.
Yeah, yeah.
But in the migraine
Yeah, I
cure,
see that. Ah,
there's a doctor called
Okay.
Zugen.
Zugen.
He's a cardiac surgeon, but he made a book called The Migraine Cure.
Ah, je
He
l'ai.
doesn't address the migraine.
Ah, je
He
l'ai.
addresses the lifestyle,
Yeah.
the hormones, and
In
all
the-
the patient.
Yeah,
They-
in the model pain and hormone that I did, I saw that
Yeah.
referral. Yeah, it's great.
Very good.
Ouais. Ouais. So you're alone, but now you're showing Jason.
Yes.
You're training
Yeah.
Jason to do
Correct.
evaluation.
He's applying our methodology. So everything that I've studied and learned over my lifetime, because it has been a lifetime. My parents, they kind of raised me like this. They didn't vaccinate me. I never got an antibiotic. To this day, I've never had an antibiotic.
Zero?
Zero. No antibiotic. And they raised me where nutrition guided the disease. And when there was a disease, it was a problem with the diet. And so we looked at the diet and we fixed the diet, and the disease would get better. So that's how I was raised. And then we came to America because we lived in Europe and we came to
Oh,
America.
where?
We lived in Italy, we lived in Germany.
Okay, you were going around.
Yeah, my dad's German and he got different
Okay.
jobs in places. But when we came here, we went to Target and my mom was like, wow, they're so sick here, you need to go into medicine. This is a job security because there will always be sick people, you always have a job. So I went into medicine and I learned conventional medicine, but I had a mind for the holistic, of course.
Like me,
Yeah.
all the time. Ça fait longtemps. It's been a long
He
time.
was good. Why? His need came late. I did about 15 years of regular practice. It was working in the emergency mostly, so that's what works in medicine.
Yes.
So that was, but at some point, there's a patient who told me, your patients are not deficient in a medication. So if you give a medication, you don't treat the cause. So, oh my God, what an idea. It changed my way of thinking.
Wow.
And then I started to look for causes.
Searching, studying.
Learn
yeah,
physiology.
Yeah,
Because you have
learning
Physiology,
physiology.
you have to learn it all the time.
I
Because
think
they hide it a little bit in school.
in emergency medicine, it's the gateway drug to functional medicine
Yeah.
because you see the worst of
Yeah, the worst.
humanity.
Ben oui.
Yeah, you saw it too.
I saw it too. I worked in the emergency room for 3 years.
And you see, they are always the same kind of person.
Yes,
They get there because of
the same.
the lifestyle.
But now a lot of people are very, very sick. They will have an increasing number of cancer also because of what happened.
Yeah.
COVID vaccine.
Yeah.
I
Yeah.
see a lot. My patient, their health is going down
It's getting
because they were
worse.
obligated. It was an obligation. You couldn't do your grocery. You couldn't work. It was very bad in Quebec.
Well, you can't do a grocery without a vaccine in Quebec.
I
You
know.
had to
pass.
get,
We
you
had
had to
a
have
pass.
pass in to go in the grocery.
They were
No.
identifying people not well vaccinated. And as a doctor, it was an obligation, a deontologic obligation to be vaccinated.
No.
They were menacés, they were.
And then he said,
Comment on dit menacés?
you know, you're gonna lose the license
yeah,
at that date.
They were
The
saying.
one who are not vaccinated, and then they get like 96%
They
vaccine.
scared a lot of
And 10
doctors.
days before the date,
Well, because of the nurses, because there were 12,000 nurses in Quebec that refused to be vaccinated. So because do you see that?
I
12,000
didn't know that.
out of the system right away because they're not vaccinated.
Wow.
Only
So
the nurses
the
resisted, not
nurses
the
they
doctors.
resist
The nurses resisted,
a lot.
but the
yeah.
doctors did not.
No.
Or they were vaccinated,
Mm.
but a lot of doctors went to vaccinate. Non mais oui, mais oui.
But sure,
No,
it's
y en a
difficult
beaucoup.
to believe that 96% were vaccinated.
Difficult to believe.
No, in the Jewish, there was scandal about it because
Oh, yeah.
they look at people. They began to do an enquête,
Mm.
an inquiry, and to see who's really because people were selling for 2,000, 3,000. They were selling passes,
Uh-huh.
passports.
Yeah.
So they began the inquiry, and they stopped because it was too much.
Oh wow.
Il disait que pas juste aux Jewish, là, mais 100,000. So,
Wow.
they back off.
Too many rulers.
Very interesting.
Too many rulers.
Maybe we didn't really have that in Florida. I know in other states.
Ben oui, c'est
it was-
c'est un État qui a respecté. It
Yeah.
was great in Florida.
Florida was very good.
Mm.
Yeah. I know in other
Freedom.
freedom in Florida.
To
Again,
choose
the
how
rule.
you want to be treated and
Yeah.
to be
Yeah.
free of anything for your health.
And hopefully more of that comes to Florida, more medical freedom, because we still have the College of Doctors that tell us still what to do in the guidelines.
Ben oui, mais ça c'est partout.
But we can still, practice functional medicine here. I know it's more difficult in Quebec to practice this way.
And even in Canada, Ontario is better. Nova Scotia is good. British Columbia was pretty much good, but now it's Alberta. They're reacting, but it's conservative too. So that's why I'm looking. Maybe I would like to have another place to work, have a license, and do whatever I have to do,
Yeah,
and continue to study all the time.
of course.
I love to learn.
Yeah.
It's my leitmotiv in life.
Yeah, I'll get
Like Pierre.
He's always studying. He
Yeah,
attends.
it's something,
He is. He attends the lectures. You should attend these lectures we join every week. So very good lectures.
Do you do it online too?
It's Zoom. Yeah.
So I could.
Yeah, we'll get you in contact with our groups, but very good
Okay, I
academic
would
groups.
like that.
Yeah.
Yeah. It's a
And you
nice-
can give lectures too to these groups. You
Yeah,
have something
probably.
you want to
I
talk
would
about?
try. Yeah, but cannabinoids.
Cannabinoids, yeah.
I'm an expert in Quebec.
Perfect.
Yeah, I did a conference in Germany because I went to Germany in a Lyme clinic in 2019, BCA lab in Oxford, near Munich,
Yep.
and I did it in English. But that was my first conference in English,
Wow.
and I did you see an article, a scientific article throughout Canada on the immunomodulation of the cannabinoids
Okay.
and neuromodulation too. It's very, very interesting because hormones are a regulation system and endocannabinoids is a regulation system too. And they are regulating each other in the body.
Wow.
It's one way to see it.
That's
It's
so cool.
and also it's functional neurology too.
Yeah.
Everything is linked
Fantastic.
and it's a balanced state. Too much and not enough, it's no good. It's a question of balancing, yeah, homeostasis.
So while you work,
In
we are
French,
continue
we-
study.
Okay.
Stop working.
You don't want to work.
No, but you will help. You have the idea,
I
you
did study
could
about measles this
collaborate.
week.
Yeah?
Measles.
What
Because
is it?
in Canada, there's
Ah,
many
oui,
cases
oui,
and
oui,
they panic.
They
There was,
panic.
there was a conference, so I did listen to the conference, interesting. And then there was a question to the pediatrician, infectiologist. And then she said, the question was, what about vitamin A? Okay? And then she said she did call the pharmacist of the hospital. Saint-Justin is the French hospital for pediatrics in Montreal.
Montreal.
So it's a big thing.
Big.
Big,
Right,
big
it's
They
thing.
probably said vitamin A is toxic, don't give it.
What they said, look at that. The pharmacist said they don't make a formula liquid for the kids. That's it. So because usually it's in gel caps, okay? But it can be intramuscular.
Sure.
And the treatment of measles is for a baby 1 year, 200,000
Yeah.
units of vitamin A intramuscular. That's the treatment.
Yes.
And in the conference, they isolate, vaccinate, but not the kid that have measles, but they don't treat the kid. And it was a conference by expert. So the pharmaceutical rep, that's expert, that's what they are, because it's terrible. I've seen measles in the Middle East, and I've seen like 4 cases, I remember.
It's misnomer.
And you have,
They
it's
don't know.
easy, not easy to diagnose at the beginning because
It looks for other things.
yeah, you're not sure
No.
because, and if they've been vaccinated, they will have less symptoms, the redness will be different.
Yeah,
But
correct, the
the
referral.
thing
because
is
your
vitamin
knowledge
A,
is-
but look, she didn't talk about the side effect of the vaccine, the measles vaccine, at all, okay? But the vitamin A in Africa, the study says 75% reduction in mortality, and maybe encephalitis and
The
in,
complication.
here in the United States, the study they made, 50% reduction in mortality because people are less deficient.
Okay.
More deficient you want vitamin A because you treat the deficiency.
Yes.
But now the recommendation is to vaccinate. But where is the recommendation to give vitamin A?
It is not.
Because the people who die of measles, it's because they are deficient in vitamin A. If the treatment of vitamin A works because you compensate the deficiency, maybe a little late, you wait till you catch the disease. But if you would give vitamin A to everyone, then everybody could catch the measles, and I think it's a good thing because when you catch measles, it reduces 50% your chance of cancer through your lifetime. If there was a medication that reduced 50% of all cancer, everybody would want it, but that's measles.
The risk in the
Nature
lifetime.
offered that to us. And then there's people who don't want you to have it. It's interesting, and I believe those people are honest.
No, they're honest, but
They-
they don't know.
They don't know?
Yeah, c'est une Bible, you're a Bible of
You know,
knowledge.
it's not- I
We
read
should
it.
use you, we should consult you to know what to do.
I didn't say it, I just repeat it. Because I
But
think
you will
sometimes
call,
it's
you will call the doctor to talk with her. Huh?
so, and when you send your patient vitamin D, it improves his health with the other things.
Yeah.
But you know there was a study on vitamin D. Like they compare the vitamin D to go to your doctor, a doctor that sees you once a year for a lifetime. It's more efficient to take a vitamin D supplement at the right dosage and never go to see a doctor than to go to see a doctor every year and not take vitamin D.
Wow.
It's more efficient for your survival amount of disease. So vitamin D beats the doctor by itself.
Amazing.
Don't need more.
You good, huh?
I know that. So I'm not convinced. But you know what? I have to be convinced before I say it. Because when I say it, I don't say it lightly. And so when I read that, I said, oh my God, I'll read again. Try to read the reverse, you know, the
Yeah.
article that says it. There's article that says vitamin D, dangerous vitamin D will make calcification,
Yeah.
this and this. But it's like, it's funny, because when they say it's dangerous, maybe it's true, could be dangerous. You know, if you take calcium supplement with vitamin D,
Well,
not
it
supposed to,
depends on
because you
the-
absorb all the
No,
calcium,
but
you
it
should not be
depends.
deficient
You
in vitamin
must
K.
readjust and you must look who's taking it. Maybe there's a way, there's metabolic something wrong or polymorphism or
Yeah, there's people who don't
personalized.
need
They
supplements.
just need K, they
medicine.
need vitamin K2.
Yeah,
And then
K2
it'll-
because we'll keep the calcium
They keep the
in the
calcium
bone.
in the bone, yeah.
Okay,
Because
one
it's-
of my patients, a cancer patient, she's doing a protocol with the nori. Do you know the
Nori, seaweed,
and also how to start cancer, McCollum. She did a book on cancer.
okay.
Ferroptosis. She's doing ferroptosis. She has a breast cancer, but it's very interesting.
Mm.
Very interesting way of treating. Yeah. So there's a lot of knowledges, but they don't want us to know because no chemo, no C, no sub.
Billions of dollars can be
Yeah,
lost
yeah,
if we had
yeah.
alternative remedies
Yeah.
for cancer.
Yeah.
It's surprising that people that say
They don't
science, you know,
Non, c'est pas
but
ça.
they don't do science. Do science, yeah. Everybody agree for science. The science has to be done, not politics.
Yeah.
Politics is like you vote for this one, but it's not science. You have the right to vote for the one you want.
Right, it's like
Don't say
hormones.
science.
They don't want to know that hormones are good for health, for healthy and optimal
Right.
aging.
We don't give like people
Hey,
like
it's
they say
dangerous.
testosterone.
Cancer.
I've seen women, we give them testosterone, they say, I don't wanna have big muscle. When they said it won't happen,
No.
because we give physiologic doses
Right.
and we treat a
How
deficiency.
do
You know, before we give the testosterone, we establish a deficiency.
Yeah.
And then we put it to the optimal. We
Ah,
don't go over
like
the
I do.
line. You know,
Do you measure? Do you
Yeah.
do a monitoring?
Yeah.
Saliva, blood?
Saliva, blood,
Urinary.
urine,
Yeah.
you can do it all.
You do the Dutch test or?
I do. It's expensive. Mostly I just do blood.
It's very
Very
expensive.
expensive. We don't do
Which
that.
one is?
The Dutch test,
Dutch
it's a
test.
urinary hormone metabolite
Yeah,
test.
but it's very good. It's
Very
good,
good.
but it's expensive.
My wife Logan has done it 3 times. It's been invaluable. It's a good test.
When you don't, you could do your management, your hormonal management, monitoring with blood tests, but when something's wrong or not, it's helpful to
To
know
do
what's
that.
happening.
The metabolite.
And also the analysis of the SNP and the other step,
The genetics.
genetics.
That I don't know. I did mine.
Not genetics, genomics.
The nutrigenomics.
Yeah,
I
yeah.
did mine and it just confused me. I'm looking at this
Yeah,
thing.
there are contradictions.
Yeah.
Like 23andMe was very contradictional at first, but the more data that we have and see the SNP that are responsible for an interference in the metabolic pathways,
Mm.
it's important.
Yes.
The more we have data, the better it is the interpretation.
Yes.
Yeah.
I probably.
Precision medicine.
I'm probably the most tested person at the practice. I've done every test on myself.
I do this, we do this. To know. I want to know.
You guys all buy the expensive tests. I'm like, oh, this is a waste. Get this out of here.
I like your way of thinking. I'm the same way.
Yeah.
We have to think about that.
So
To be
we-
accessible.
Oh yeah, very accessible. And patients, they can text me. They can email me.
Are you insurance? If people they're not able to reimburse your consultation or your
No,
fees?
we are direct primary care, so it's like Netflix for your primary subscription model.
Okay.
Every month flat rate, whether they see me or not.
Okay.
And then they say, but I haven't seen you. Can I cancel? I'm
No.
like, no, you cannot. You can cancel, but you cannot see me. But why don't you come in? And they come in, and I tell them all these things like, oh my God, I didn't know this. Just make an appointment. We run the test. We'll optimize you. But then we're also there in case you need us as well. If you have a cut, I can suture you. I mean, I can do basic stuff like that as
Oh
well
yeah?
too.
Oh, yeah. Are you okay? You're organized for that?
I do biopsy, I'll suture, I do anything.
Like me.
Perfect, please.
We do it all. We do advanced testing and we do sutures, everything in between. We try to keep our patients out of the emergency room. We never send them there.
So,
I never a one.
In Quebec, you don't wanna go to emergency.
No?
No, not at all.
But you get the CPA.
In Schefferville, it's far from my home.
You get lucky of the draw, you get to see functional medicine doctor in the ER.
How did we connect? Because I knew you from Vincent Comtois, I knew
Oh,
you,
yeah.
okay? But yeah, I bought me your book at first, and then
Maybe
I thought you were
through
from-
the pharmacy, maybe.
yeah.
Bertrand. Maybe.
No, maybe Info, COVID, and other réunion or meeting with
My brother.
santé intégrative.
My brother. Because I did send you my brother.
Oui, mais avant ça, before.
I trusted her to send my brother.
You trust me.
Do you still practice, well, when you did work in the ER, did you do functional medicine in the ER?
Not in the ER, but it depends.
You can't help it.
Yeah, but you know, it's like it could have happened, yeah.
You tell him to take a
Pourquoi
vitamin
ça
C.
t'arrête
What
de
is it?
sonner? Parce qu'elle est partie, la fusée. Because they were
There was a
launching.
launch.
Oh yeah, that was yesterday, the launch.
Yeah, but it was cancelled.
Oh, okay,
And
so
maybe it was cancelled again.
Probably.
Yeah.
I still practice some level of functional medicine when I worked in the urgent care clinic and I see them and I do a dietary intake and I ask them what they're
Okay,
eating.
do you still work there?
No, I don't do anything other than this now, but I used to. And I would still ask them.
Do you live here?
Yeah, I live here, no.
Okay, not in the.
I mean, no, not in this building, no. But I come here enough. But no, I'd ask them, like, what are you eating? They're sick here. The child is 5 years old, chronic congestion, and antibiotics, comes into the urgent care all the time. I ask, do they drink pasteurized milk? The answer is yes. I'm like, cut out the pasteurized milk. And then it goes away. I'll see them, maybe the parent or the child again a couple
Ouais,
months later.
surtout,
Yeah, it makes them congested. I said, get rid of the pasteurized milk, and it fixes the congestion. Yeah, dietary intake.
So they
Very
cannot,
easy fix.
They cannot get real milk, so just stop milk.
Correct. If you can't get raw
6
milk,
months, six
just
months
stop.
old, you stop milk.
Du lait de brebis.
Maybe, yeah, maybe
Du
goat.
lait de brebis, goat.
Well, it depends how they raise, huh?
Yeah.
Because
In
they-
Canada, I read this. You can get raw milk, but you have to buy a cow share. You have to
Yeah.
like lease a cow, and then you can get the milk.
Oh.
Yeah, you can get it in Canada.
Il y a beaucoup d'affaires qui se font comme.
Here in Florida, you can get raw milk, but it labels is not for human consumption,
Okay.
and then you know it's good.
I like it.
Then it has all the enzymes are alive in there. There's lactoferrin.
Yeah.
You mentioned ferroptosis. So lactoferrin is an enzyme that's found only in raw milk, and it steals iron from iron-loving bacteria.
Yeah.
So it's actually naturally antimicrobial. It's the milk, the raw milk is intelligent. So in order for bacteria not to grow, there's lactoferrin in there, and it inhibits the bacterial growth in the milk.
Okay.
And then there's other things that are very beneficial. There's lactase, there's digestive enzymes, and there's amino acids that are not denatured. When you heat the milk protein is denatured, and you do not process the amino acids so well. And then, forget that all, and when you superheat milk, especially here in the US, they have the ultra pasteurized milk. This becomes lactulose, which lactulose is used for hepatic encephalopathy, it's used for constipation. It's a diarrheal agent. So they're literally giving children a diarrheal agent. The more the milk is heated, the more concentration of lactulose is formed from lactose.
Okay.
So the patients will come here, they say, I'm lactose intolerant. I'm like, is that true? Did you ever try raw milk? No. Then you are lactulose intolerant, which everyone is.
I like it.
Okay,
I
yeah,
like
because that's what it does. Mhm.
La comparaison.
Yeah. You just have to explain that to people. And explain to doctors, they know what lactulose is. That's a powerful agent.
Yeah.
It make you hypokalemic. I mean, this is,
Yeah.
yeah. Get them off the milk if they cannot have if you cannot find a raw milk. Just get them off all dairy products, in the breads, in the cookies, in the yogurt, all of it. Take it away.
Do you do courses? You continue to study and everything?
We go to
You do
A4M.
Courses, A4M?
A4M.
No, in May. In May there is a A4M
You'll go?
Congress. I cannot come
Okay.
because we have a summit of integrative medicine
In Quebec.
Canada. I have some issue. I'm selling my business.
Really?
I want to do doctor work, conferences. I want to teach. and C patient.
Yeah.
But
Other than that, I find the most valuable.
yeah, A for M and
is-
IFM too, but no.
I like the Zoom calls that we do throughout the week. They're
Oh,
super
yeah.
valuable. Much better than IFM or A4M.
Hey, I want to do it. I will subscribe to
They're
your
they're
site.
free.
and,
They're free.
Yeah.
No problem. Yes.
I'm doing a webinar and Zoom things a lot
Yeah.
online. It's practical because I'm staying home and I'm seeing things and
Learning.
it continues.
And then also they'll ask you to come and give a lecture. So you gotta study something and then you have to sound smart and give a lecture.
Yeah, CMR,
Yeah, the level is very high, isn't it?
yeah.
And the doctor, they behave well, everybody's polite, you see it's a high level of
Very high level.
science.
Respectful.
There's no word that says.
Respectful.
Yeah, but sometimes people just need to express themselves and it
No,
becomes
but sometimes
a
people
forum to it.
need
No, but it's
sh-
not that.
to do a
It's
show.
like science.
Yeah.
It's they
Some of the
thought when
doctors
they,
have a big ego.
Sometimes, not there. They're all there to learn.
yeah, but then in those
But
conferences,
I want to be part of it.
Okay, good. We'll get you signed up.
Okay.
you behave, then you can work.
My English is good.
English
But
is-
I'm tired because I slept 3 hours because I had to finish my work before coming and taking the plane.
Oh, wow.
Yeah, she flew.
But it
Fresh
was
off the plane.
yeah. But I'm staying with Pierre. But one of my friends is taking me, and we're going to St. Petersburg. Then, yeah.
Beautiful.
So short vacation, but it's nice.
Tampa, St. Petersburg is very beautiful.
Maybe I will go to in May. I'm not sure. I saw it.
Yeah.
Well, it was tempting to be there.
We will all be there. My parents will be there. I got us a little house.
Yeah,
down
maybe
there.
I will exchange with you. We'll see.
That's
Okay.
fun.
Yeah, I saw it.
Pierre does.
You have a conference tomorrow night too? Because-
Tomorrow? No.
Because you sent me.
Oh, I know. I meant it, but it's 2 nights.
Okay, okay.
It's at 8 p.m.
Because I
tonight.
was not sure if it was tomorrow.
No.
It's 7:15.
Oh,
It's
okay.
tonight. You're
Yeah,
doing it
8
tonight?
p.m. tonight. We're gonna do a little lecture with the strength coach Q&A session.
Okay.
To your client like you do.
Yeah.
every week, okay.
Yeah, like we did 2 weeks ago.
So you exchange. You're discussing clinical.
Actually, no. This will be on the principles of exercise science. So I know a local strength coach, and then he's going to come here, and patients will write their questions, and we will talk about the questions.
Okay.
It's fun. It's like very
You have
modern.
you invite people and you talk.
Yeah, all my
People
patients.
are okay. Q&A from the.
They write the questions, and we answer. Me and the strength coach.
I see. Fun.
Last week we had a nutritionist, and then the week before we had Pierre and my parents. And we got to talk about hormones, Cortef, DHEA.
You were talking about it. You were the invité.
That's good. I liked your thing about vitamin A. And,
Why me too?
Yeah, it's very important.
Can you do it again? Say all your.
I like him when he starts talking anti-vaccine rhetoric. It's fantastic. It's good for good for the views.
Vaccine people say science. But is there science that have more benefits than side effects? And there's not.
Injecting.
So everywhere you look, and now
No, there's
I
no
think
science there.
I think that this temper for the dogs is a good vaccine. I'm not sure, I'm not finished, but I found a vaccine that may be good, but for animals. And why is that? It may be because those animals were domesticated and they have still problems. So at least I found a vaccine.
Which one's for
this
dogs?
temper.
Never heard of it.
But
This
Stamper, c'est pas la rage.
Yeah, that's
no?
one of the disease they vaccinate the dog, and if they don't, they can be very sick. So that's the survival.
Mais ça donne des diarrhées puis des GI symptoms.
So that's one of the vaccine I've not finished to study, but I think it's good. But in the human, there's none, because when they all do the vaccine, you're gonna be back.
It
Imagine
depends.
we'll talk about a little physiology. The measles, the COVID, it comes from the throat, the airway, and you vaccinate there. So you're gonna have IgG antibody in your blood, but the secretion IgA you have none. So you will catch the microbe, it will reproduce there, and then when it gets inside, okay, in the blood where the serum where you have IgG, maybe you will be less sick, but you will still catch it and it will still be contagious because it doesn't prevent that, and you'll be less sick. So if somebody had like a pertussis, let's prove, and he's never vaccinated, okay, he will be more sick. So he will stay home. He will not give it to others, and he will be contagious 50 days. That's an average. But if he was vaccinated, he will be less sick, so he will go more to school, spread it more, and he will be contagious for 60 days. So what does vaccine? It's so you should mandate the one who are vaccinated to stay home, because the others stay home. The one who are not vaccinated, they stay home because they're too sick to go to school. See, so those vaccines, when they say efficacy,
Say one way of saying
Yeah, but-
that's a good.
yeah, but the vaccine, when they say that efficacy, yes, they have an efficacy, if not, but to reduce the symptoms of the generalized disease. But it doesn't have efficacy not to catch it and not to spread it.
Yeah. And multiple vaccination with an mRNA coding for an inflammatory protein that goes everywhere in the body. What do you think it does?
You could have choose another
Your
part of the virus.
T cell, your NK cell immunity is down the drain,
Oh, good.
and with no antibody because it's 3 weeks only, and they do it again. So it's dangerous. They are killing people with that. I think so.
Oh yeah. Mortality rates, if you look at their life insurance data, is very high.
The CDC published a statistic on cancer, turbo cancer. Okay, very accelerating.
CDC published.
CDC,
Okay.
an increasing range of 143,000% increasing since 2020
It's a lot.
of turbo cancer from the States statistic.
And why does the CDC think this is happening?
Right.
They say, oh,
They say probably because
global
people-
warming.
Yeah, maybe.
Maybe
And
the
probably
OMS,
there was
the
no
OMS.
investigation during the COVID lockdown, so people now got more. But they will have. But the CDC, when people say CDC, I think they were not reliable. Okay, and they did not tell the truth many times. So people, my father used to say, don't do business with bandits. See? If you know you're bandits, they steal you, you get too close, they steal your wallet, but it's your fault because you know he was. So don't do business with the CDC, the FDA, and the government. Because they are like bandits. See, that's it, simple as that. So because my father was a dentist, and then they say to me, that liar like a dentist. A tooth puller.
Okay.
So I said, my father, are you lying? You're a dentist, are you lying? He says, son, a good liar tells the truth most of the time. So that was funny, his answer. So he didn't say lie. Yes, he said, but most of the time I say the truth. So those people, like the CDC, they will try to say a few truths sometimes.
Yeah.
Because
So they say, the CDC says, and there's honest people there.
It's diminishing the suspicion about the fact that it was unilateral. It was
But
not
like in 1984, there was a study about the psychedelic drugs for psychiatry use with prescription. Okay, so psilocybin, LSD, MDMA, and ayahuasca, those things. Okay, and there was a study and a recommendation of the committee that they should be used in a prescription by a psychiatrist or doctor that knows about it.
Back in '84, they recommended it.
Okay, and you know what? The president of the FDA vetoed it and said no. So it's now it's reason why it's coming back, because those doctors that were there, they all retired. They don't not afraid.
They retired or dead.
Now, and because they would have lost their license. So we're run by people that are not honest.
Right.
See, and most of the people will say, "Man, look, if they are there, it's because they're honest." It's like authority is. With authority, you have a responsibility. When somebody gives you the power, you become responsible. Now, the ones who have the power are irresponsible, and nobody watch. It's like in the police. The people they are in the police. They can drive fast because they know their friend won't give them a ticket. But that's not the way you should think. The police should give the example.
Yes.
You should not have a privilege because it's a police. like us, we are a service of our patient.
Right.
So we don't, not supposed to be privileged, we're
No.
supposed to be servant.
Mm.
And with responsibility, you're supposed to be servant.
Yeah.
Always, because already you get recognition, you get paid, you know, it's like socially paid, it's very good. Be honest, simple. Simple.
How do you say Organisation Mondiale de la Santé Mondiale Health?
World Health Organization.
World
Yeah.
Health
Mm.
Organization.
Mhm.
They're no good neither.
No, they're no good. They're idiots. Unfortunately.
They try to control everything.
They want people to eat the bugs. They want people to diminish the amount of meat they consume. They want people to eat the seed oils, right? And they're like, no, none of this. We're not with this agenda.
Mm.
Unfortunately,
Thank you for that political.
No, thank you for that.
we got him. We got him talking. It was so
On
fun.
le craquet,
Yeah.
en français on dit on le
Oh,
craquet. We pull the trigger. Boom, boom, boom.
Oh, yeah, got it out of him.
Yeah, I think you say we used to say math 101, you know, in school.
Right.
Now we should do ethic 101.
It's
Everyone.
ethical, yeah.
Yeah, because
It's not
that's
ethical.
Mhm.
But people are waking up, yeah, I think.
Are the doctors waking up?
Some. I think people are more and more the worse they are in trying to control everything. People are saying it's no good anymore, or they won't believe it anymore.
Mm.
So be bad, worse enough, so people will wake up.
Yeah.
And it's the patient, it's the population that has to wake up.
Yes.
The doctors are waking up because they see the damages of the
Really?
vaccine, COVID vaccine.
That would be
The
something.
doctors are sick. People are dying.
Oh.
Healthy people are dying.
Mm.
So we see more and more the damages. So, and they say, oh, it's the bibit, it's the COVID, it's the viruses, the bacteria. No, it's your immune system that is no good anymore. You were not exposed. You did have a lot of vaccine. I'm talking like that, but I'm very, very. I'm trying not to be too much on one side or another. I just want to put a consciousness question in their head.
That would
Talk
be.
to yourself. Ask yourself why.
Mm.
Say like that. I'm doing like that.
I don't have enough communication with normal doctors, PAs to understand if they're changing or not. So I don't know. I take it from you. I don't know if you're still involved in that community at all, but I'm not.
I have doctors who are more conventional in my clinic. I have nurses. I have a lot of people, but my mission is to educate them.
Yeah.
So it's not always easy because it's my business.
Mm-hmm.
And the doctor is the patient. So I'm going there. I'm educating the patient to say to them, you're your own doctor. Learn to observe yourself. You will, and I will give you the knowledge. And if you understand what's happening in your body, you will be more in control of your health, healthier too. So that's the way I want to work from now on.
That's how I have always wanted my practice to be. I don't want to be, this
And
up here and the
who
doc
are
and the
we?
patient down here.
Who
No.
are we
No.
to say to someone else what to do?
I want to give my patient the information, the knowledge, so that they understand.
And they decide.
They decide and they can heal themselves. Yeah.
Yes.
These are the tools you have.
In French,
You have this right here.
Yeah.
Yeah.
Auto-guérison,
Yeah.
healing from
Yeah.
yourself.
And usually when you give an advice, the patient has to do it.
Yeah.
You know, it's like, I did try, I did improve, but it's not enough.
Yeah.
Do it
I'm
right.
not like that though. We're different from that.
Him is like that.
Yeah. My patients, they are
You must responsibilize your patient.
make them responsible.
Yeah.
Empower
I
them.
told you a story today, I will repeat. There was that patient, perfect patient. He does everything I say. After 3 months, he's not better. He says, I've done everything you said, and I'm not better. I said, at least it proves something. It wasn't that. I really said, you never had the last words always. So we'll try something. And that was
So that's true, you
Yeah,
have
metal
always
toxicity.
the last word.
Yeah, because that's the only thing we didn't test.
Metals.
Nothing was working. So
Heavy metal.
Heavy metal.
yeah,
And
I think
molds?
it was like
Yeah, we have that
mercury.
here a lot.
It was a mercury
Molds?
patient.
That we it's human.
Yeah. Were you in Quebec exuded?
No, but here.
Here, yes.
The weather and.
Yeah, people deal with mold a lot here.
Yeah.
Metals probably too. Yeah. I don't test so much for metals. I usually test for
Hypersensitive.
Well,
mold.
usually,
Hypersensitivity and hyperreactivity, and it's a lot. Sometimes it's molds.
Yeah.
Yeah.
I have mercury because I eat sardines.
Oh yeah.
So I get in the sauna every day to sweat it out.
Okay.
the sardines you don't have much.
But you don't
I
have
think I do.
You think?
I think so because it's in me. I've tested twice now. I have mercury.
Yeah.
Yeah.
But sardines are small fish. It is big fish. Tuna?
I do eat tuna.
Ah, that's tuna. Blame on the tuna, not the sardines.
One of my patients was, she had a sushi restaurant and she was eating sushi. Sometime that I tested her for mercury and the sentence poison. She's intoxicated! She had a very high level,
Very high level.
but she was not sick. But they were very, do something, it's that she was eating fish every day,
Yeah.
raw fish.
Oh wow.
Yeah.
Yeah. Yeah, I'll get into my sauna every day. I'll take a binder sometimes,
Okay.
like a zeolite
Wait.
clay.
White like clay, right?
Yeah, zeolite. That's what I do. Maybe I can detox. I don't have any of the symptoms of the mercury.
Je sais pas si je connais pas mal d'affaires, mais j'ai appris, I've learned a lot by doing functional medicine conferences or workshop, very intensive workshop with Dr. Horowitz with Lyme disease.
Horowitz.
Yeah.
Sounds familiar.
And we see a lot of mast cell activation syndrome right now because of the vaccine too.
That's unfortunate. What a drug you can use for that is amlexanox.
Oh,
Yeah, amlexanox, 40 milligrams 3 times a day.
Oh.
It's a drug used mostly in Japan. They use it for the asthma and the chronic allergies and the mast cell. So you can use it here as well. It'll work for your patients.
Comment you call it?
Amlexanox.
Okay.
AMLEXON.
And what it is, it's not
Monte
Montelukast.
Lucas. It's not Monte Lucas.
Okay.
No, it's different. And we
Okay, we could exchange online.
I learned about
wait.
this from Dr. Halassa of Chronic Disease Prevention and Management Group.
Wait, I like it.
You're gonna.
I will learn a lot.
You
from
will learn
you.
a lot from them.
And from you.
And from me.
Just talking with you, I'm learning a lot.
I learn from these groups. I teach them things, and yeah,
C'est
amlexanox.
vraiment fun. C'est
Ouais.
good. C'est très
Vas-y.
fun. Je suis toute énervée.
Unbelievable for
I
age.
love you.
Usually when they know that much,
I'm
they
doing
retire.
that.
They know that much they retire. Like you.
I don't know as much.
I told Pierre, I said, Pierre, you come work here for me. He's like, no.
We'll convince him.
Yeah.
Okay? He would be good.
Oh,
You have your floating.
He said, I want to boogie board, I want to go on my motorcycle.
No, but
Yeah.
he could be a coach, he could be a consultant, he could be to do podcasts with you, just to your knowledge. You have
Yeah,
too
come on.
much.
I
He
come
has-
here
You
to learn.
cannot keep that for yourself.
I have my patients there buying your book.
Yeah.
I met him yesterday, he said, such a good book, it's so simple, but it's so practical.
Yeah.
Yeah.
So it's basically, if you do all this, you
Optimal
won't be sick.
physiology.
Yeah.
Because it's basic,
It's good.
you know, there's a lot of things we can do to treat condition, but that book doesn't talk about it. Like you said, if they all do what's in the book, they will not be sick.
Right.
Because there's the supplement basic, supplement fancy,
Yeah.
the food, the exercise, the hormones. So it
Covers a lot. It's a
A
good,
lot.
it's a good basis for
T'as de
foundation.
bien du
yeah.
contenu.
And if you do all this, you respect that.
Yeah, it's a quick
Like
read.
even lithium, there's a
Can read it in a
Yeah.
weekend. Lithium, yeah, we've been using lithium a lot. It's fantastic. Yeah, I got that from you.
I got that from Jonathan Wright.
Yeah, right.
Like 25 years ago.
Yeah.
And he had a very good result. His patients were not having Alzheimer, taking that, no depression, no suicide.
Is it
It's
from
80% reduction in suicide.
Yeah, cortisol manager. It's good.
No,
for-
where we can get that?
Yeah.
Integrative?
Yeah,
Is it from here?
I can give you a sample. It's good for those with stress. It's an adaptogenic herbal now you don't have adaptogens and herbals in your book because it's not natural.
Yeah.
You just talk about naturals in your book.
c'est un adaptogène.
Yeah.
No, it's not natural. Pierre says not natural. I don't use them very much, but on occasion I'll use herbals.
But is it
sometimes.
good?
Yeah, it works very well for those with stress. Yeah.
What is it in it?
It's ashwagandha,
Oh, wait,
rhodiola,
wait,
and
wait,
magnolia.
wait,
It's
wait.
like a couple.
Like we have
Adaptogens.
it, yeah. But integrative, you don't do that.
It's
You-
just a
it's
company.
a company
It's a
like
company.
Metagenics or
Yeah.
Aware,
Yeah,
Pure.
just like that. Integrators, just like that.
Designed for health.
Yeah.
Right. You have the
Yeah.
same here. Be
Get
better.
ready for the next one.
Yeah. Which one?
Next
Oh
one.
yeah, at 8 p.m. That's true. We have another podcast. Cool. Yeah, that was fun. We will see you on the Zoom calls. And how long are you staying here in Florida?
Until I'm going to St. Petersburg on Saturday. So
Nice.
I'm leaving on Saturday
Beautiful.
morning.
Beautiful. Enjoy that. Yeah.
But we'll keep in touch. Moi, j'ai décidé, j'ai pas amené mes cartes
For sure.
d'affaires. J'en ai une online. J'ai une carte d'affaires
Give it
online.
to me, I'll give it to you.
Ouais.
I'll come back.
Yeah. He's a local here.
Yeah, I want to have you. Do you have some? Can I reach you? Can you give
Yes.
me your?
Yes, you can text me.